Hello and welcome. Before we begin, here's my disclaimer. I have a master's degree in counseling and applied psychotherapy. I am not a doctor or naturopath. The purpose of this course and presentation is to convey information. It should not be interpreted as medical advice, and it's not intended to diagnose, treat, or cure your condition, or to be used as a substitute for advice from your physician or other healthcare professionals. The methods discussed in this program are intended to support health and healing, not to replace your medical treatment. Whether you choose conventional treatments, alternative treatments, or both, it's imperative that you work closely with your doctor or healthcare professional to properly diagnose and treat your condition, and to monitor your results and progress. Even though I mention evidence-based supplements and medications that are proven to help with migraines, anxiety, and depression, you must first discuss these options with your doctor. Please treat any supplement as cautiously as any medication. Thank you. Hello and welcome to the Migraine Pain Management Workshop. My name's Holly and we're going to talk about how to get effective migraine relief. Today we're going to cover a lot, so get settled in. We have about an hour. We're going to look at the basics of migraines and what it is and what happens in the body. We're going to look at the 4 phases of a migraine episode. We're going to look at some natural alternatives, some foods and supplements that can help you find relief, and what else you can do to help prevent your attacks. So just to give you a little bit of background about myself for those of you who don't know me, my migraine started back in 1992 and they never stopped until about 2 years ago with menopause. So I had them for 20 days each month. Initially they lasted 10 days. So it was 10 days on, 3 days off, 10 days on, 3 days off, 10 days on, 3 days off. It just went on and on. So that's not a common pattern. It made it very difficult to get a diagnosis. It took 14 years to find effective pain relief, and that was using triptan, naratriptan to be exact. And then another 5 years to really get it right with my timing. So I have 19 failed medication trials. It's been a very long journey. But one thing in particular that I found helped me the most, even after I found the naratriptan to help, I still had a lot of breakthrough pain for years. So this huge turning point for me was learning about timing. And what I mean by learning this is exactly when you need to take your abortive or to take action to stop the migraine from progressing to the pain phase. So there's really a 20-minute window. So we're gonna discuss that a little more in detail in a bit. I didn't know anything about migraines back then. I thought they'd just go away if I stopped stressing out or if I thought more positively. Have you been told that? But that wasn't the case. So I think it's really, really important to know about the basics of what a migraine is, the causes, and what to look for in each of the phases. Now, it's not a linear progression. Some of the symptoms can occur in any phase, but I think the most important ones to really get a handle on are the ones in the prodrome. So we're going to cover that in a minute. But I think it's really important to understand timing. So all of this is going to point towards what's going to be your timing. And learning what's actually happening in your body is crucial because you can't just wait until the pain hits. That's too late. The head pain is phase 3 of the migraine. So I think one of the most common misconceptions about migraine is that it's just that pain phase, but it's not just the pain phase, it's this entire chain of events. So a number of bodily systems are involved, including the stomach, your muscles, and your blood vessels. So it's really not just on your head. It really does involve a lot of other systems in the body. So the current evidence suggests that nerve storms cause the neurological dysfunction. So more specifically, when inflammatory chemicals are released and circle around the nerves and the blood vessels in the head, this causes overexcitation, it causes excruciating pain, and the other symptoms. So basically you have the triggers that cause a chain reaction of events, an overexcitation of your nervous system, that results in the symptoms, and then the escalation continues. So the head pain is actually the third phase of the entire episode. Now I just want to break that down a little bit to make it more clear. So it starts with a trigger, and that could be any trigger. It could be food or food allergies. It could be any other allergy, weather changes, hormonal changes, smoke and perfume. Even though my migraines have stopped, they are still a trigger for me. I just got triggered last week from some cigar smoke. So it can be any one trigger, or it can be an accumulation of triggers that just add up. I'm actually calling it trigger tolerance. I don't know if that's what other people are calling it, but there definitely is an accumulation of the triggers. So then you have what's called spreading excitation. It's also called spreading depression or a nerve storm. And this is explained as a wave that slowly spreads across the outer layers of the brain, the cortex. And this electrical charge is carried by brain neurons. The neurons send signals to other brain neurons during normal brain activity. But in a migraine, they rapidly discharge some of their electrical charge via negative ions. So this is considered the dysfunction. Now this is all really complicated, and to kind of keep it simple, I just think of it as an overactive reaction in our brain and our nervous system. So again, it's not just the head, it's not just the brain, the whole nervous system is involved. So all of this overexcitation causes the chemical brain messengers to become imbalanced. So there's the chemical reaction. Then there's a disturbed blood flow to the brain that causes the blood vessels and the arteries to constrict and then dilate. That's when you get a lot of the pain. This overstimulates nerves in the brain, and that pain signal is sent from the top of the brain back to the brainstem. And so this reaction cycle just continues. I told you it was complicated. Now, a lot of this goes on without us knowing about it, until we detect a symptom. Now, I'd just like to mention a few things to watch for so you can help yourself figure out if it is indeed a migraine or a headache. The International Headache Society defines migraine attacks as having at least 2 to 4 of these features. So one is pain affecting one side of the head only. Most of my migraines were right-sided. My face would swell so much that my eye would shut. Back then I used to use a short black coffee to help abort the attack. It worked really well for years until I got addicted. So that's a really good tip, to use a short black coffee to help abort an attack. So caffeine can work really well if you don't drink it every day. So back to the features. So the pain affecting one side of the head only, pulsating in quality, moderate or severe in intensity, and aggravated by exertion. As well as, and this is a key, nausea with or without vomiting, sensitivity to light, sound, or smell, or a combination of any or all of those symptoms. So in my case, I had quite a number of symptoms, including the visual disturbances, but this is a key. It's a key difference between migraines and headaches, is that migraines are normally accompanied by a number of other symptoms. I think it's also important to know about the 4 phases of migraine. So we're going to cover these quite thoroughly so that you know the symptoms, and especially the symptoms in the prodrome to watch for. So the first phase of a migraine is the prodrome. The prodrome symptoms can occur hours or days before a migraine episode. Hours or days. So if you can learn to identify your symptoms in this phase, this will provide you with an early warning signal that tells you a migraine's on its way. So this is the phase when I talk about timing that I want you to take action to help abort your attack. There's a 20-minute window. So the sooner you feel that sensation of migraine, the sooner you need to act. Now, waiting till the pain phase is too late. I used to wait till the pain phase, till my pain reached about a level 4 out of 10, and then I would take my Neuromig, and that just created a lot of breakthrough pain. So waiting until the pain phase is hit is too late. You want to take action with your prescribed abortive or your alternative pain management strategy right at the beginning. Now I'm going to go through some of the symptoms so that you know exactly what to look for. Now, forgive me for reading them out, but I don't want to miss a single thing. So, irritability and depression, sensitivity to light, sound, or smell, nausea, poor concentration, fatigue and muscle stiffness, difficulty in speaking and reading, difficulty with sleeping, excess yawning, an increased need to urinate, and food cravings. Now, a couple of other ones that may not be on the common list are anger or extreme emotions like crying. So I used to get very angry before an attack, or I would just burst into tears for no apparent reason. So I would put those in with the prodrome phase and for something to watch for, to see if something like that comes before you notice a migraine. Okay. Now, a note on food cravings. Everybody thinks chocolate triggers a migraine. Now, you may crave chocolate after the migraine's already started because food cravings are part of the migraine. Does that make sense? So if you did have chocolate and it triggered a migraine, you may need to go back a lot further in time to discover your real trigger. Now, people crave different things. Some people crave sweet. I crave salt or carbohydrate. Carbohydrate's a really common thing to crave when you're getting a migraine, and it can turn into sugar. So you need to watch your carbohydrate intake if you get migraines. Sorry. Okay. Now, the second phase is the aura phase. Some typical symptoms to watch for in the aura phase are visual symptoms like flashing lights, wavy lines, spots in your vision, maybe blank spots or blurry vision. Visual symptoms are they're noticeable. So you will know if you're getting an aura. Olfactory hallucinations, so smelling odors, smelling odors that aren't there. I used to always smell smoke before an attack. I still do, in fact. Partial paralysis, tingling or numbness of the face or the extremities on the side where the headache develops. Difficulty finding words and or speaking, and confusion. Dizziness and vertigo are also associated with the second aura phase. Now, the third phase is the most well-known phase, and that's the pain phase. So this is the most difficult part of migraines to describe to others, the pain phase. People do not understand this phase unless they actually get migraines. Even those that are close to you probably just don't understand how intense the pain can be. So here are some typical characteristics of the pain phase. And there's not just the pain, right? There's all these other symptoms that you'll get as well. So pain on one side of the head. It can also become bilateral, so on both sides. Mine used to shift or switch sides during a long 10-day migraine. So you could have sensitivity to sound or light. You could have nausea and vomiting. You can have diarrhea or constipation or both. Congestion or runny nose, depression or severe anxiety. Now, just a little note on anxiety. Your body already knows that the migraine's coming, so adrenaline can get released during the attack. So anxiety can be really common. It's a little bit hard to determine if it's just your anxiety about the migraine coming or if it's part of the migraine episode. Other characteristics are hot flashes and chills, dizziness, confusion, and dehydration. Now, like I said earlier, these aren't just particular to the third phase. They're not linear. It's not a linear progression. They can kind of occur in any of the phases, so it does get quite confusing. But if you can become aware of your initial sensations, that could really save you, in the end, save you time and help you abort your attack. Learning that will give you your best chance at aborting the attack. The fourth phase is called the postdrome. So it can take hours or days sometimes to fully recover from an attack. So I call it a hangover. But the after effects can look like this: melancholy, depression, fatigue, poor concentration or an inability to concentrate, lack of comprehension, poor memory, or just one of those or a combination of all of them. Okay, now knowing this, in my opinion, will give you your best chance at stopping your next attack, particularly your symptoms in the prodrome phase. So you must get your timing right. You have a 20-minute window to abort an attack. So medications or alternative pain relief will be most effective if you can action them in this 20-minute window, or just as soon as you have that first sensation that you're aware of. Now, you also have to consider allowing time for what you choose to work, okay? Initially, like I said, I'd wait till my pain was at a 4 and I take my Naratriptan, and Naramig takes 2 hours to work. So depending on what you choose to take, it could take up to 2 hours to take effect. If your pain phase comes on really fast, there are different delivery methods like injectables, there's nasal spray, Maxalt is a wafer that dissolves on your tongue, or rectal methods that will all be more effective because they bypass the digestion, which is slowed when you have a migraine. So, and those will also work regardless of how nauseous you are if you're experiencing vomiting. So if you vomit something up, don't take another one. Medication or supplement, it doesn't matter. Just don't risk an overdose. There's a lot of medications that are originated from herbs. So even if you take supplements, I feel it's best to be cautious. Now, what about natural pain relief? We covered a little bit about medications. The best natural treatment I have found to treat an acute migraine attack was from Dr. Christiane Northrup. Her method can help you abort an attack before any medication is needed. So it's very simple. Her treatment strategy involves using ice and heat at the same time. So there's 4 steps. It's really simple. So first and foremost, which is what we've been talking about, is timing. Take action at the first sign of neurological disturbance, okay? Which for me typically involves both eyes. They feel like they're in a vice being crushed. And I know that's a migraine, one of my very first early warning signals for migraine. Now you want to put ice behind your neck. It's essential that your neck is iced, and you want to put a hot water bottle on your stomach and rest your hands under it. So it's essential that your hands are warm. Cold neck, warm hands, and you can also, number 4, is to keep a blanket or something on your feet, but keep them warm as well. So Dr. Northrup says that cooling the blood traveling to the brain through your neck and warming your hands helps prevent the powerful vasoconstriction and the rebound vasodilation that results in the head pain. So doing these things at the same time has the potential to abort your attack, but you must act at the first sign your body gives you, okay? If this alone doesn't abort the attack, then you'll have to consider adding other things to your pain management strategy. And there are drug-free prevention alternatives, options like the Cephalate device or the Gammacore device. Ideally, if you can get to bed or lie down, just be in a very dark room and try to rest, that can be crucial. Sleeping can often help with migraine attacks. I know this isn't always possible, but if you can, get home as soon as you can, or just find somewhere, a dark room to rest in at work, and try to sleep it off. If you're light sensitive, you will benefit from using an eye pillow or some kind of cover to completely block out the light from your eyes. You still with me? Now we're going to talk about food. There's 3 foods that you can use for acute treatment, and I've got 2 ideas for you regarding prevention. Now, we already talked about one for acute treatment, and that's a short black coffee. Now, it has the potential to abort an attack, but it will not be effective if you drink it every day. You'll have to use it almost like a medication. Now, the best results I've gotten so far is using powdered ginger. The studies were done using a whole teaspoon of ginger, which is incredibly hot, but that proved as effective as the abortive medication sumatriptan at stopping the pain phase of a migraine attack. That's huge. Ginger, you can just get it out of your spice rack. Now the dose, if you were to use a teaspoon, is very hot, so I'd recommend starting off with 1/8 of a teaspoon or 1/4. You might find 1/2 is your best dose, but you can take it every 20 minutes if you're not getting pain relief, and it's safe. The only trouble is that it might be a little bit irritating on your stomach because the powder can irritate a bit, but it's up to you. There's also ginger capsules that are an easy alternative. Now, this other one you probably haven't heard of, but it's umeboshi plum. It's a common Chinese cure for migraine headaches, and umeboshi plum neutralizes extremes. So again, you would eat a quarter of the plum every 20 minutes, right from onset, and that might help abort an attack. Now, they're very salty and they're very sour, but salt constricts, which might explain why it works. So, now a couple of things to try for prevention as far as diet goes is the ketogenic diet. The ketogenic diet is neuroprotective, so it might help you prevent future migraine. It's also anti-inflammatory, and as a migraine sufferer, you need to protect your nerve cells as they get overstimulated and overexcited and fire off. And the other one is low carbohydrate. If you can't change your diet, you can test out if carbohydrates are a migraine trigger simply by testing a whole baked potato versus a half baked potato. So keep a diary and just see what happens when you eat half a baked potato, see if you get a migraine, or test it with a whole baked potato. Give it a week. Don't try it 2 days in a row, but try it 1 week and then a week later, or even a month, and you might test. You can test other carbohydrates too, but I find potatoes quite a yummy and easy test. Now, there's a few supplements that can help you find natural relief, but there's only a few with really good evidence behind them, and that's butterbur, magnesium, and vitamin B2. And when I say good evidence, I mean the American Academy of Neurology recently published guidelines on drugs and natural products that were useful in migraine prevention. Now, butterbur is the only one that was proven as effective as some of the best prescription drugs. So the supplement they tested was called Petadolex. Now, that's an extract of the butterbur plant, and there's been a couple of double-blind studies showing that the most effective dose is 75 milligrams twice a day. Now, there are a number of studies that prove butterbur's efficacy with migraines. I'll just give you one study because it's got some decent numbers behind it. One 4-month study with 245 migraine sufferers found that the frequency of attacks was reduced by 68% for those receiving 75 milligrams of the supplement twice a day when compared with the placebo. So that's 68%. That's a really good result. But you have to be careful with butterbur because if the extraction's not done right, there can be toxic alkaloids in it. So Petadolex is a safe brand. So magnesium is the other one that's got some good evidence behind it. Actually, B2 and magnesium are both published in the American Academy of Neurology guidelines. Magnesium is the second most abundant mineral in our human cells, and it's the most likely mineral for us migraine sufferers to be deficient in. Now, it helps the body regulate over 325 enzymes, and it plays a vital role in organizing some of our important bodily functions like muscle control and the all-important electrical impulses. So that's important for us as migraineurs because we need to calm our electrical storms. And it also assists in a host of other things, but the recommended dose is 200 milligrams twice a day. I guess the downside is that it might take a few months to see benefits, so you have to be patient. But the double-blind studies have proven it to be quite effective for migraine prevention. Now, I'd like to highlight just a couple of things about magnesium because it comes in many forms, and some of them cause cramps and diarrhea. The other thing that's really important is how you actually digest the magnesium. So capsules and powder are much easier to absorb than a hard-coated tablet. So I recommend a powder or capsules. So the powder is in the capsules. So glycinate is one of the best forms to take if you get migraines, but there's also 2 other formulations you need to know about if you get migraines. So there's magnesium malate and magnesium threonate. Now, it's really important to know about these other 2 because one might be more effective for you at reducing your attacks. So magnesium glycinate is one of the most bioavailable sources of magnesium, which means you will absorb and digest it well. And it's the least likely to cause problems in your intestines or to cause diarrhea. So this is the one that's most commonly prescribed. There's also magnesium malate. This one's become my first choice, as the combination of magnesium and malic acid actually increases energy and reduces pain. So if you experience diarrhea from this form, just reduce the dose or go back to try the glycinate. So just to give you an idea, malic acid is found in apples, pears, tomatoes, and cherries. It's a naturally organic substance, but it really does help. I discovered it when I had fibromyalgia. I took it for about 3 months and it's never come back. Lucky me. So magnesium threonate. Now this one enhances memory and cognitive function. So it's recently been studied and found to promote brain health, and it supports learning. So if memory and cognition are a problem for you, this might be the magnesium to try. It's just a third option for you to experiment with if you're not really getting the results you want from the other two. So the next one is vitamin B2, riboflavin. The recommended dose is 200 milligrams twice a day. You can try the newer bioactive form of B2. It's called riboflavin 5-phosphate, or R5P. Much easier to say. Now, vitamin B2 is essential for activating and converting other B vitamins. It's a really crucial vitamin for the body. It's also essential for fat and glucose metabolism and the production of certain hormones. So this would make it one of the top supplements for you if you get hormonal migraines. The next one is feverfew. It's got mixed evidence and kind of inconsistent results in the studies. And the quality varies due to the quantity and the standardization of the active ingredients. But it does have anti-inflammatory benefits. So you can try this one. It's been used for centuries for headache relief. The recommended dose for feverfew is 100 milligrams taken up to 4 times a day. Now, I have clients on quite a lot more than that, a higher dose, but you'd really have to talk to a nutritionist or your naturopath if you want to go outside the guidelines of what's on the box. I mean, obviously you always have to read the recommended dose on the side of the box because every single supplement has different ingredients and a different amount of feverfew in it. So the active ingredient parthenolide prevents blood vessel constriction. So it also reduces the inflammatory process in the body, which can help reduce migraine attacks. So make sure your supplement's been standardized for the parthenolide content because they're pretty much useless without it, sadly. And there's a warning with feverfew. Do not use it if you're pregnant. So you really have to be careful if this is your solution, if you are wanting to have children. And you also don't use it if you have any allergies in the ragweed family. Now, the last supplement I want to mention is CoQ enzyme 10. There's limited evidence for CoQ10, and it interacts with some other medications. So I would always, as always, recommend you check with your doctor before trying any new supplements. Plus, it's expensive. It's a lot more expensive than riboflavin, the vitamin B2. And they work through similar mechanisms. So I would definitely try B2 first, but I think they're equally effective. There's been a lot of studies done on CoQ10. The recommended dose is anywhere from 50 to 300 milligrams 3 times a day. So you'd really have to experiment with that. I tested 150 milligrams and it just gave me more migraine attacks. So I didn't go well with CoQ10. There's some really good combination products around. One's called Migraine, and it's got a good blend of ingredients. It's got butterbur extract, vitamin B2, riboflavin, magnesium, and coenzyme Q10. And there's been some good studies done around this particular supplement. There's good proof for the efficacy for helping to prevent migraines and reduce the frequency. There's another combination product I like called Migraine, and it's got riboflavin in it, the B2, but it also has the R5P. There's 400 milligrams of that. It's got the butterbur at 22.5 milligrams and some ginger extract at 12.5 milligrams. So the problem with combination products is if you do have a reaction to it, you won't actually know which ingredient's problematic. So, and the other thing with supplements is that you may need to experiment quite a bit to find the right dose for you. So you can't really do that if you're sensitive and you want to build up in a supplement. You can't do that with a combination product. Okay, so far we've covered the basics of migraine. We've covered the 4 phases. We've covered some natural alternatives. We've covered some food and supplements that can possibly provide you with some relief. Now let's look at what else you can do to prevent attacks. Yes, there's more. Okay, there's some really good evidence behind being proactive to help prevent attacks. So what I mean by this is making healthy lifestyle choices or making better lifestyle choices. Never underestimate the importance of this. You can really work towards preventing your next attack by just establishing some changes. And I'm going to go over 10 that can help you. So number 1 is to keep a migraine diary or a journal. So not just a food list or not just a what I did list, activities list, but when you get a migraine, write down what you can remember about the past few days. Who visited, who made you angry at work, did anything bother you? Was there a deadline? Were you getting really stressed about the deadline? Did you miss a meal or miss a night's sleep? Did you have a bad night's sleep? But by keeping track, you might see a pattern emerge. And there's a lot of good apps you can use, actually, to help you track your migraines. I tend to do it manually because I like to see things spread out that I can track. But it's up to you. Whatever works for you, start keeping track. Keep track of symptoms that you have before and after the attack. Keep track of everything that you can think of that you might need to share with your doctor in the future. Now that leads me up to making sure you develop a very solid pain management plan with your doctor. The third one is, that was number 2, so the third one is creating routines that might help you with migraine prevention. So things like keeping regular eating and sleeping patterns, waking up and going to sleep at the same time every night and every day, even on weekends, so no sleeping in, and eat regularly, eat nutritious meals. You can, if you get migraines from low blood sugar, then it would be a really good idea to snack throughout the day between your meals to keep your blood sugar levels balanced. So, and never skip meals. Number 4 is to get regular exercise. So exercise has been proven to help reduce migraines. It's also known to raise your endorphins, so the feel-good hormone. And it stimulates the pain-regulating hormones in our brains. So that's a double bonus. Number 5 is to practice some relaxation techniques. So keep it simple. Even right now, if you're comfortable closing your eyes, just exhale as much as you can and then let your breath come back in. Exhale as much as you can till you feel kind of the bottom of your stomach pressing in. And then just let all the air come flowing back in naturally. So it'll be a deep breath, and just hold it for 5 or 10 seconds. Don't let any stress happen. Don't let your shoulders clench up towards your ears. Just be really comfortable, 5 or 10 seconds, and then slowly breathe out again. Breathe out and exhale, like a forced exhale. So you're just tightening your tummy at the bottom, and then let it flow back in. So you can repeat this up to 10 times with your eyes closed. If you are comfortable doing that, even 3 times will bring you some benefit. So the key is the long exhale. The long exhale activates the parasympathetic nervous system. So that's your rest and digest system. And if you can learn to meditate, I have found it profoundly beneficial. So meditating is another great skill to learn. If you're at work, it'd be really great if you could try to take regular breaks from your computer or repetitive tasks. If you can walk around the block or go somewhere where you can just breathe deeply but get away from the computer and not collapsed. If you do collapse in front of your computer, taking some deep breaths will make a nice change for your body. So number 6 is, this is a bit of a no-brainer. If you haven't already, stop smoking. Smoking is a known cause. It causes blood vessel constriction, and it's a nasty mix for migraineurs. Number 7, stay hydrated. Now, you have to drink enough water for your body weight, okay? But it's not all about water. I also kind of talk about getting the right balance of minerals to balance your electrolytes. Now, all the details of these kind of things are in my course. In case you don't know, I've written a book that really helps you deal with anxiety. It's got a process in there that kind of walks you through making some really huge decisions, but it should be able to help you tune in and make everyday decisions as well. And my online course kind of covers everything migraine. It's everything that we're talking about here and more. I'll tell you a little bit about the course while we're on that. It's called the Migraine Pain Management course. So I'll just briefly mention what's in the course, and then I'll get back to the last 3 things that can help. Module 1 is demystifying migraines. So it's everything we just kind of talked about, understanding the basics of migraines and learning about the 4 phases of migraines so you can treat them effectively and stop them wherever possible. I've made Module 1 free because I think it's just that important to learn. Module 2 is called Immediate Self-Treatments. So Module 2 looks at exploring your support options. You can choose from a menu of self-help treatments or self-treatments that you can implement right away to help prevent future attacks. So it goes over the ice and heat method that we discussed earlier. There are ways to get, or tools to get, emotional support and ways to manage stress, depression, and anxiety. And there's a 8-week food and supplement journal, experimental journal, and there's an 8-week stress journal as well, with different experiments in it for you to try. They both include different experiments that you can try to reduce your stress levels and to help with food and supplement testing. Module 3 is working with professionals, and it's all about creating your healthcare team that covers all your needs. So 9 times out of 10, you're not going to just have migraines. You're going to have things that they cause, or you're going to have other things going on, or you might want to take another approach, more alternative approach. So there's a number of different kinds of professionals you will encounter on your migraine journey. Module 4 is creating a pain management plan. So I think this is one of the most important modules for surviving chronic migraines, and that's developing your pain management plan. So there's step-by-step instructions here, and it is to do with your medications. It does include 3 different treatment plans for you to take to your doctor and work with him or her on, so that you can have the best chance at aborting your next attack. Details like what happens, what to do when things don't work. So, and it goes down a few levels. So really to keep you out of the ER. All the modules include activities, and these activities help you to get organized and kind of achieve your best results possible and in the shortest time possible. So the whole thing's designed to help you take action now. Module 5 is dealing with setbacks. What to do when things don't work. Failed treatments can really take their toll, and this module will really help you equip yourself with resilience tools and provide some ways to help you deal with some of your relationships if your pain becomes a problem. There's some bonuses. I have guided meditations. There's a Facebook support group. There's a 30-day money-back guarantee if you're unsatisfied for any reason. And you have direct access to me. All of the details are on this page below the video. Or below the video there will be a link to all the details. So let's get back to the last 3 things that will help us with our coping skills. So number 8 is actually learn better coping skills. So I just gave you a hint with the course, but you'll need to build a network of professionals who can help you manage this condition, especially when it gets too hard to handle on your own. Number 9 is to learn to prepare ahead of time for your attack. Okay, so have all your practical tools that help you all in one place. So you have your migraine diary, your ice pack, your hot water bottle, your eye mask, your earplugs, your water, Always have a migraine care kit ready. Now, number 10, as we mentioned, is sleep. Sleep can often help ward off an attack. Perhaps not always abort it, but definitely help it be less intense and less in duration. So overall, to help you manage migraines long term, it'll really help to find a good doctor you can work with, to build a really good solid pain management plan with your doctor, to find effective preventatives, so medicinal or alternative, whatever works. If alternative therapies don't work, you may need to look at the medicinal, the medicines. There are some really effective medications out now that you can ask your doctor for. They're all in the course. There's a list of medications that we go over. It's really important to become an engaged and informed patient, okay? Educate yourself. Stay in touch with me. Stay in touch with whoever feels right for you, and be open to experimenting to find what works. A lot of the migraine journey is trial and error. You know, in my book, Migraine Management, I mentioned the movie Groundhog Day with Bill Murray. I always think of how he gets another chance each morning to take advantage of what he's learned from the day before, and he uses it to his advantage. So we can do that too. With each migraine, we learn something different. We try something different when things don't work until we find what works. So even if it's just something little, it could make the world of difference in your pain levels. So, for example, I used to turn into an ice cube, an icicle when I had a migraine. So I used to use hot water bottles on my neck and my head. I mean, little did I know that that was just the wrong action. Now, a lot of you may get relief from heat instead of ice. So I'm not saying absolutely do not use heat, but what I'm saying for me is in those days I got 10-day long migraines. And when I switched to using ice on my neck, it broke them up into 4-day migraines. So now I could go on, but we really do have to wind up. So please know that you can change things for the better. You have more help available now than ever before in history. And more help's on the way with gene testing and more targeted treatments like the CGRP medications. There's one released already. We've got electrical devices like the Cephalane, the Gammacore that are all drug-free prevention. So there's some really great minds out there. They're working to help us with migraines, with prevention and hopefully elimination. Now, I hope you have a happy, healthy, positive week. And thank you for watching the Migraine Pain Management Workshop. I hope you've learned something new to take away and that it will help you abort the next attack. Stay strong.